Okay, this is my sterile technique video. So I have Charlene Knight's orders here. Her birthday is 8/8/39. She's allergic to latex, penicillin, and betadine. She has an order for a Foley catheter because she's having urinary retention, so I'm going to go into the room and check that out. Hi, I'm Daniela. I'm going to be your nurse today. Can you please tell me your name?
I don't remember.
Okay, Charlene Knight. And your birthday? 8/8/39. Alright, and your allergies? Latex, penicillin, and betadine. Okay. So, I see on your order here that you've been unable to urinate, and you have an order from the doctor for a Foley catheter. So I'm going to go ahead and assess that and see if that's an appropriate order. So I'm going to put this down here. Hand hygiene. Gonna don some gloves.
Okay, that's wrong. Okay. Take your glove out. Make your fingers like this.
There's still doing one more, right?
Use firm fingers. Don't wiggle and jiggle.
Okay, I'm going to go ahead and put this other down. Alright, I'm going to pull this back here, okay, Mrs. Knight?
I go up.
Okay, so at this point I would be assessing to make sure that I can visualize the meatus, and I would be making sure that there's no irritation or redness. I would also be checking for any distension in the bladder, which she does have, so this would be an indication of that she needs a catheter. And also I would be making sure that the site is clean, and the CNAs, I guess, already did pericare this morning, so there's no need for that. So I can go ahead and get the catheter started.
Yeah, because that's not old, so it's not enough.
Hand hygiene. So I have the catheter kit here, and it's the same one as on the order. It matches up. There's nothing in here that she's allergic to, so there's no latex, penicillin, or betadine. It is not expired, and I would be checking to make sure that it's intact and everything like that. So I can go ahead and push this to the side and start with the sterile procedure. So, actually not just yet. So I would take this out, I can drop that, put this on a clean, dry surface, and I would make this into a trash receptacle, put it at the end of the bed. And I'm also going to position, Mrs. Knight, I'm going to reposition you now. I'm going to put her in the dorsal recumbent position.
It's pass fail. And we do it electronically. If I watched your video, I'm going to bring it in.
Okay, so we have a clean, dry surface here, and it's at waist level, so I can go ahead and open it up. Oh, I'll do hand hygiene one more time. Okay. So I'm going to go ahead and open this up outwards first, only touching the outer 1 inch, and then the left side, and then the right side, oops, and then closest to me, being sure to only touch the outer 1 inch. I'm going to turn it a little bit to make room. And now I'm going to grab the drape by the corner, push it up, take a step back. Only holding the corner, I'm going to place this down on the patient, shiny side down. So I'll do that now. And then I can reposition this a little bit. Okay. Now I'm going to grab the gloves. I'm going to step to the side here so I have more room. Open these up. Making sure I'm only touching outer corners. I'm going to open it up from the flaps. Okay, I'm going to grab the dominant hand with my non-dominant hand on the cuff. And I'm going to slide my hand in there, palm side facing up. Okay. Next hand, I'm going to slide my fingers in here. Same thing, palm side facing up. Fingers, but fix that in a second. Okay, so I can go ahead and fix this now that I'm sterile. So. Okay. So, making sure I'm just touching the sterile part. That's all good. And I can go ahead and keep going. I'm going to grab the drape by the corner. And put that out. Drape this down on the patient. Okay. Next, I would take the hydrogen peroxide.
Are you guys done in this bed?
I would open this up, drop it in the trash right down, make sure it's not under waist level. Pour this all over the cotton balls. Okay? Dispose of this in the trash. Then I would take the lubricant, open it up, pour it into the box, and I would also drop that in the trash. I can now reposition this box, still within the 1-inch borders, and I'm going to take hold of the catheter. Actually, first I'm going to grab the syringe and uncap it. This is sterile water in here and 10 milliliters. So I'm going to attach that to the catheter. And I'm going to grab the catheter tip and I'm going to slide this off, making sure that I don't lose control of it. And I would also drop this in the trash. I would lubricate the catheter. And place it back in the box. At this point, I can also place this back on top of the box and bring it over to the patient. So, I'm going to reach around it. The sterile field. And so now I'm going to start cleaning the patient. So I'm going to use my non-dominant hand to hold open the labia. And what I'm going to do is grab the forceps, and I'm going to be cleaning from clitoris to anus, starting with the outer. So I'm going to go outer, and then come around the sterile field, making sure not to contaminate it. Then I'm going to do inner, coming around the sterile field. And then I'm going to do middle, around the sterile field. And then I'm going to do outer, inner, I'm all done with this top part, so I can take it off and drop it behind me. Now I'm going to be inserting the catheter. So I'm going to be holding it 2 to 4 inches from the tip. This is nice. I'm going to be inserting the catheter now, so you're going to feel a little bit of pressure. So if you could just bear down, I would be making sure not to touch the labia, and I would needle the catheter in. And if I feel resistance, I would make sure that I don't feel resistance. And I wouldn't be feeling resistance. There we go. Okay? And I would push it in until I see urine, which is now, so I'm going to push it in 1 more inch. Okay, at this point I can stabilize it with my non-dominant hand and start inflating the balloon. As I'm inflating the balloon, I would ask Mrs. Knight if she's feeling any pain or discomfort, and she says no. If she was feeling any pain or discomfort, that would mean that I'm inflating the balloon in the urethra instead of in the bladder, so that would not be good. Okay, so give it a little tug, make sure that it's in place, which it is. So at this point I can remove the needle. And sterile procedure is over. So I would be attaching the tubing at the bifurcation right on the patient's leg, and I would take the bag and attach it to the hook on the bed, not on the bed frame, or not on the bed rail. I would attach it to the hook here. And then I would ask the patient how she tolerated that, and I would be coming back and assessing eye and nose every shift, and I would document as recorded, which was 10 milliliters of sterile water, and I would make sure that I'm doing catheter care every shift, and I would, take the gloves off, do hand hygiene, and that's it.